which you know, so which we love, because even though there may not be very many people here,
There could be.
there's lots of views, and then you could always share them later and stuff too.
So that's great. Yes.
Okay. Well, got a couple of minutes, and
Okay.
then I'll do it well.
Okay, sounds good. Thank you, Renee.
So will you just give me like a big start down and I'll just do a quick intro and be on my way. Thank you, guys. I'm gonna touch base over here. Have we been in communication? What's your name?
David Wise.
David, I'm
We have-
Renee. You're like,
Yeah.
boy, have we been in
Yeah.
communication?
A few times, one or
Maybe
twice.
too much
Yeah,
communication.
down,
Nice to meet you.
nice to meet you. Yeah, so happy we're able to do this.
You too.
It's been on, it's great.
Good. Good. We've got a good setup.
Yeah.
It takes.
It's great. I know that the online audience is there as well.
Some flyers in the back that
Yeah.
Dr.
CRM style.
dropped off, so I just keep bringing
Yeah,
that.
and if you need more, let me know.
Hello, there we are. Hello, thank you for joining us today. My name is Renee, and I welcome you to the library this afternoon. I'd also like to welcome those of you who are watching via live stream as well. If you would, please note the feedback forms in the chairs and on the back table, and take a moment to share your thoughts on our programming. Your feedback does help us plan future events. Today's talk is part of a medical topic series in 2025 the library is proud to offer with UAMS Family Medicine and College of Medicine. This series will feature doctors, social workers, nurses, and other medical professionals presenting valuable information on a variety of health issues. We have a flyer on the back table listing out all the programs for the rest of the year. The next program is on Friday, June 13th. It will be about PTSD, post-traumatic stress disorder. Our topic today is asthma, a chronic condition that affects the airways in the lungs. It's my pleasure to introduce our speaker, Dr. Janelle Hudson. Dr. Hudson is an associate professor in the College of Pharmacy at University of Arkansas for Medical Sciences, Northwest Regional Campus. She's involved in research related to diabetes, self-management, education and support, medication adherence, and health disparities. She's a Fayetteville native and proud graduate of the University of Arkansas. Thank you for being here, Dr. Hudson. Take it away.
Yes. Well, I want to thank the library for having me today. I want to thank our in-person audience as well as thank those that are online who are joining us today. Just a little bit about me kind of before we start. I am a Fayetteville native, like she said, from Northwest Arkansas. You may wonder, well, why is someone so interested in diabetes talking to you today about asthma? Because she talked a little bit about my diabetes passion. Well, my second passion, right along with that, is asthma. And that started when my son, when he was a little less than a year old, was diagnosed with asthma. So I had taught as a pharmacist. I had taught hundreds of people how to use inhalers and all of that kind of stuff, but I really hadn't dug into how to appropriately treat asthma. until he was diagnosed. So anybody out there listening or in here today, I have been through the inhalers, I have been through the nebulizers, I have been through the school systems, I've been through sports camps and other camps with a kid that has asthma. So I can definitely relate to all of you who are out there, mothers, parents, and personal people who have asthma. And I'm just hoping today I can give you a little bit of reassurance in living with asthma, and that although asthma is a chronic disease, it is something that you can definitely manage and live a full life with that. My son, even though he was diagnosed when he was less than a year old, he is 18 now. He graduates high school next month. And I'm happy to tell you all that he has not needed a rescue inhaler since he was in the 6th grade. He has not needed any kind of rescue medication related to his asthma. We've been able to do a lot to help control that for him. So hopefully you'll learn a little bit about living with asthma today. So the first thing, let me see if I can get my slides to, there we go. Oh. There's a little delay. Okay, so the first thing I wanted to touch on is what is asthma. So asthma involves what we call persistent inflammation of the airways. And so the way I like to explain this is if you have an injury, like to your wrist or to your foot, and it swells, that's called inflammation. But in our wrist and in our knees or whatever, when it swells, it kind of swells outward. With asthma, what you see on the far side is a tube in your lung, a bronchiole, where it has inflammation, but instead of swelling out, it swells into the breathing tube, which narrows the breathing tube, and it makes air more difficult to move in and out. So this inflammation that's in there causes the airways to swell. It causes them to tighten. They produce a little bit of extra mucus that further narrows the airways, and this is obstructing the airways so that you can't breathe very well with that. What distinguishes asthma from other conditions in the lungs has to do with this inflammation. And when you have this inflammation and it narrows the airways, again, that's what causes the difficulty in breathing. That inflammation can be triggered by a lot of different things, and we'll talk about some triggers. And that inflammation is what causes the symptoms, the swelling, the wheezing, the coughing, and the chest tightness associated with it. So while there's no cure for asthma, there are medications that we can use that will help lessen the swelling within those airways, and also by avoiding the triggers that decreases the opportunity for that swelling to occur. So my son is not the only famous person that has asthma. He's not famous, but we'll just say that he is, right? Because we mentioned him today. There's lots of people that you have probably heard of or seen that actually have asthma. So David Beckham, he is a famous soccer player that recently retired. He lives with asthma and has been able to have an athletic career and control his asthma and still be very successful in that. Former President and former Arkansas Governor Bill Clinton is known to have asthma as well. There's a singer named Pink that some of our audience may be aware of, who does very athletic and acrobatic performances at her concert. She's known to have asthma. Jackie Joyner-Kersee, who was a 4-time Olympian, went to the Olympics 4 different times over a period of 16 years, has asthma and had a very rich and rewarding career associated with that. I think she was a heptathlon. I think she was track and field. And so there's Eminem is a rapper, and to be able to talk that fast as a rapper, you have to have good vocals and good control of your breathing, and he is someone who has asthma as well. So lots of people are able to have successful careers, lifestyles, and all of that kind of stuff, even with the diagnosis of asthma. So what are the symptoms associated with asthma? You can see here on this circle, there's coughing, there's wheezing, and the wheezing is usually when you exhale air. Not when you inhale it, but when you're exhaling air, you may hear this wheezing noise. There's shortness of breath, there's chest tightness, And those are the common asthma symptoms. There can be others as well, but those 4 are probably the most common. There can be trouble sleeping because when you lay down, your breathing might get worse, or when you're sleeping, your breathing gets worse with that. The ones over there in the red box are the ones that I like to call the emergency kind of symptoms with it. So the first one in there is called retractions. And what that means is if you look at your rib cage and while you're breathing, your skin is sucking in between your ribs, that's a sign that you're using extra muscles in your abdominal cavity to help you breathe. And so if that's the case, you see it a lot in children, then that's an emergency sign or an emergency symptom with asthma. Fingernails or lips that turn blue is an indication you're not getting good oxygen at that time, and that's an emergency symptom. Pale and sweaty, again, you're not getting good airflow. If your breathing is so difficult that you can't talk, you can't make a sentence, that's an emergency symptom. Very rapid breathing is one as well. And then the last one is anxiety. If you just have this overwhelming fear or feeling of doom with your breathing at that moment, that's also an emergency sign. And those are when you would want to go and seek emergency help right away. If you have these other signs, the coughing, wheezing, chetonitis, and shortness of breath, we hope that you can treat those at home and be able to stay home with that. But if not, those would also necessitate a physician visit. All right, so how is asthma diagnosed? Asthma is diagnosed, of course, by a physician or a medical professional. There are some questions that they'll probably ask you, and I put an example of one up on the screen today. This is called the asthma control test. It really just talks about the last month, whether or not you've missed time at work, at school, or at home, if you've had shortness of breath, if you've had symptoms of asthma, if you've had to use your rescue inhaler, and how you would rate how you feel your asthma is controlled. So this test is often used after you're diagnosed with asthma to kind of see how your therapy is working for you. The higher the score, the better on this one. The lower the score, the worse your asthma is controlled right now with that. So how we use this asthma control test in clinic is when you come in for your clinic visit related to your asthma, we'll have you answer these questions, and then in those areas where you seem to be having some difficulty, we may focus on those a little bit more to try and understand what we can do to help you in that area. So not so much used for diagnosis, but used a lot to help monitor people that have asthma. A lot of times for diagnosis, we send for what are called pulmonary function tests. And pulmonary function tests measure how well you're moving air in and out. So a lot of times they'll put you in that sealed room where you see that gentleman sitting right there. They have an apparatus set up in that room, and they'll plug your nose and they'll tell you to blow out all your air at once and then to keep blowing. So anyone that's had one of these will recognize the terminology when I go blow, 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 because you think you've blown out everything you can in your lungs, but there's probably just a little bit left in there to continue. And then they'll say, okay, breathe in, and you take another deep breath in. And the whole time the machine is measuring the volume of air that you are moving in and out, and then they compare that to what they would consider a standard for your age, your sex, and your height for that. So there's an example of a person that's sitting in a room. The one next to it is a person that's not in a room, and they're just doing it connected to the computer. And either one of those can be done to help you diagnose asthma. So once you have the diagnosis of asthma, I think it's really important for everyone to recognize their own triggers. What triggers their breathing to get worse? And everyone is going to be different with this. There is no common one trigger that everybody is going to have for their asthma. There are some common ones here that a lot of people do have, so we're going to kind of talk about these. A big one is tobacco smoke, or really any kind of smoke. It can be from tobacco, it can be from burning wood outside. It can be from, like if you go on a camping trip and you have a fire in front of you, or when they happen to do those controlled burns outside. A lot of our people that have asthma need to stay indoors when those kind of things happen, because those burns can actually trigger their asthma. The next one that's listed up there, if we're going around the circle, is dust mites. Dust mites are things that are found in anything that has fabric. It has nothing to do with how cleanly you are. They just live there. That's just part of our environment. So if you have an allergy to dust mites, then it can trigger asthma. So what we do for people that are sensitive to dust mites is, because it lives in mattresses and pillows, you can buy special dust mite covers for your mattresses and your pillows that prevent the dust mites from coming through when you're sleeping on them at night. Air pollution is another one. We don't have a lot of air pollution, I think, in Northwest Arkansas, but there are some cities around the world and around the country that have much higher levels of pollution. And in those areas, sometimes you'll see more people diagnosed with asthma. Cockroaches is another one. So it's not the cockroach itself, it's some kind of dropping that they leave in the environment that they live in. So we recommend that you put all your food away. You don't have open containers of food that might attract them. If you see them, you get an exterminator to come out and help rid your home of those, because their droppings can trigger asthma. Anything with fur and feathers, right? So birds, dogs, cats, the dander that's associated with those. If you have an allergy, they can trigger asthma. It's a hard discussion to have with people that have pets on whether or not they can keep their pet or not. I've only had one situation where we have actually had to have someone get rid of their pet, and it was because they would have such a severe asthma attack that it would put them in the hospital with that. And we did all kinds of testing, and it was pet dander that actually was their trigger for that. And so they did have to rehome their pet with a family member. Mold is another common one. You can see mold in bathrooms, under sinks. So if you have visible evidence of mold, then we recommend that you treat that and get rid of that. But cleaning supplies is another one. You know, those things we'd use to clean mold with, right? I think what that really is implying is very strong scents. So bleach has a very strong scent associated with it. A lot of cleaners that you use to clean your bathroom and to clean your home have very strong scents associated with them. So it would be the same for perfumes or candles or anything like that. If that's a trigger for you, then we need to figure out another way for you to clean your home. And then the last one up there is flu and respiratory infections. This is why we recommend that everyone with asthma get their yearly flu shot. And everyone with asthma get a pneumonia vaccine as well, because those infections that can get in your lung can be much more serious in people that have asthma, and they can have worse outcomes if they get those than those people who don't have that disease. So those are the common ones, but there are other ones out there. There's all kinds of allergies in Northwest Arkansas, right? We have grasses and trees and pollens, and if you're allergic to those can trigger your asthma as well. So this list is not at all inclusive. This is just one that are common, that we commonly see in individuals. But it's important, I guess the point that I really want to make with this slide is you need to find out what your own triggers are. What your triggers are going to be different than what someone else's triggers are. So really paying close attention to what you're doing or what you had been doing prior to having some of those breathing difficulties can be helpful. So how do we treat asthma? Okay, so the treatment of asthma is going to be centered around this constriction and this inflammation that's going on in your lungs. So we have asthma treatments that treat the acute symptom, meaning you're having difficulty breathing right now. What are we going to do? Right now you're having a problem. You need to have something available for you to use to treat when you're having a problem right now. The other one is about medications that prevent asthma symptoms. So they help control that swelling. They keep that swelling down. They keep that swelling away so that if you are exposed to one of your triggers, hopefully it won't trigger that inflammation to occur in your lungs. So there's various types of medications. They're inhaled medications that we use so that they'll go directly into your lungs. There are ones that we call bronchodilators. What those mean is it just makes your bronchioles get bigger so that more air can move in and out of those. But those bronchodilators don't do anything for the swelling that's in there. So once they wear off, your lungs kind of go right back to that swelling that they may have had. So because of that, we also recommend inhaled steroids. So inhaled steroids are the medicines that control the swelling. They're the ones that you take in every day. You use them whether you're having symptoms or not a lot of the times. And it helps to keep that swelling down. It also helps those bronchodilators work better when you need them, and it helps so that hopefully when you're exposed to a trigger, you might not get the swelling that you usually would if you weren't on them. So I want to take this opportunity to talk a little bit about steroids because there is some public concerns, I know, about the use of steroids in patients. And because this medication is delivered as an inhaler, it goes just into your lungs, and that's kind of where it stays, you don't get the effects all over your body that steroids can cause. So you take them in, they go into your lungs, they work where they're supposed to, but they don't distribute throughout your entire body. So I know there were some concerns many years ago about whether or not these steroids would, in kids especially, would make it so they wouldn't grow as tall or something like that. And that just hasn't panned out. That's not true. Uncontrolled asthma may affect your height as a kid, but using the steroids to control your asthma will not. And so I just wanted to address some of those public concerns that people might have with steroid use. And then the last thing I'm going to talk about is what we call SMART, which is same, maintenance, and reliever therapy. So we talked about two different inhalers, right? One you use for acute symptoms, one you use to prevent asthma symptoms, but now we have a medicine that you can use for both. You can use it for both treatment and you can use it for prevention at the same time. And so you may hear the term SMART therapy or MART or something like that. That just means that you get one inhaler and you use it for controlling your asthma, and you also can use it if you're having asthma symptoms. All right, so let's talk about the different treatments. I have some props that I brought with me today so that you can see these. So this is typically what an inhaler is going to look like, right? It has the canister that has the medicine in it. It has a mouthpiece on the outside, has a dose counter on the back that usually counts backwards, so you know exactly how much medicine you have left in your inhaler. These medicines tend to work best if you pair them with what's called a spacer. So this is an example of a spacer. You can see one on the slide that an infant is using that has a mask associated with it. So I have an example of one of those as well. But there's all different kind of spacer devices that you can use. So rather than putting the inhaler directly into your mouth and squirting it, that oftentimes will hit the back of your throat and you end up swallowing some of that medicine. We really recommend that you use it with a spacer. And that's all it is it provides space in between the inhaler and your mouth so that you can breathe that medicine in. So I'm going to demonstrate really quick how we recommend that you use these, right? So each one has a cover on the outside, and you take that cover off. The inhalers, you usually shake them before you use them, so give them a good shake. They also have a cover on the outside that you'll want to take off. And then they just fit nicely in the back of one of these spacers. Now, to use this, we're going to breathe out, and then we're going to put the spacer in our mouth. We're going to breathe in, and as we're breathing in, we're going to punch, I guess that's not a real technical, actuate or whatever. We're going to hit the inhaler button so that the medicine goes into the tube and we breathe it through. Now, the nice thing about this device is it has a little whistle on it, and the whistle will tell you if you're breathing too fast. So with this kind of inhaler, you want it to be a very slow and deep breath into your lungs. All right, so I'm going to demonstrate going too fast first, and then I'm going to demonstrate how it should look. All right, so you breathe out, and you bring it up. Could you all hear that little whistle? Okay, so that whistle just means my breath in is too fast, and I need to slow that down. So what you should do instead is like that, a very slow and deep breath. Now, if you have children, it's really hard to have them do this. So what we have instead is the mask, that you take the mask, you put it up, I don't know if y'all can see it up against my hand, but it's collapsible. The mask is collapsible for a reason. It's squishy. So when you put it up against their face, you want to push on it so it collapses and kind of seals around their mouth. And then they just breathe in and out. I mean, it's very hard to look at that little baby. It's really hard to instruct that little baby, right, to take a deep breath in. So with young kids, usually under the age of 5, you just use this, and they just kind of breathe that medicine in and out, but making sure you have a good seal on the outside associated with that. With adults, we do use one of these, and we recommend the one with the whistle so it can let you know if you're breathing in too quickly with that. So that's a typical kind of inhaler. We also have what we call dry powder inhalers, and that sounds a little scary, right? That you're breathing in a dry powder. But actually, they have found that these dry powders go into your lungs really well. So they work a little bit different. To get the powder in, you need a rapid breath. You need to get the powder into your lungs, and by that you have to really fast and really quick. So just the opposite of what this one looks like. So if it's a dry powder one, this is an example of one. A brand name would be Advair. You want to hold it like a hamburger or like a sandwich, like this. And then the cover comes off, exposing the mouthpiece. It should be a little lever on the side that you push back it activates the powder. And then when you put it up to your lips, it's a rapid breath in. So I'm going to show you the example of that. Really fast and rapid. All right, so 2 different techniques depending upon which type of inhaler that you're using. If you're using an inhaler that looks like this, it's a very slow, deep breath. If you're using a dry powder inhaler like this, it's a very fast breath with that. All right, so those are the different kinds of inhalers. The machine in the middle is called a nebulizer, and that's where you can put liquid medicine into this little capsule thing that's attached to the mask. And that machine then turns that liquid into a vapor, and you just put the mask on and you can breathe in and out. So we do recommend nebulizers in people who we don't think can use these kind of inhalers correctly. But the majority of people, you can see on that picture, even little babies with some help, can use these meter dose inhalers with that. All right, so how are we going to manage asthma? So management of asthma includes, outside of medication, includes lifestyle management as well as trigger avoidance. So lifestyle management includes things like regular exercise. So as long as exercise is not your trigger, then we recommend regular exercise. Stress can worsen asthma symptoms, so good stress management. Being overweight can worsen asthma symptoms, so maintaining a healthy weight. Good sleep actually keeps your immune system strong and fights off all those infections that you could get in your lungs, so we recommend good quality sleep. And we also, again, recommend that people stay current on their vaccinations to help prevent any of those illnesses that could affect their lungs. And then, of course, I can't emphasize trigger avoidance enough. When we find out what it is that triggers your breathing issues, doing everything you can to avoid those will really benefit and help and control that swelling with asthma. All right, so when should you seek help? That's sort of the question. So immediate help, when you should seek it, is if you're using a rescue inhaler. And so a rescue inhaler means you're having problems breathing right now. Right now I'm having difficulty. I need to rescue myself from this breathing problem, and I need to take my rescue medicine. If you're taking your rescue medicine and it's only working for a few hours and your symptoms come right back, then you need to seek help. If you're having a hard time speaking, you can't form a complete sentence because your breathing is so hard. If you're having a hard time breathing even when you're at rest, if you're sitting down in a chair, you're not being active, and it's still very, very difficult for you to breathe. Again, your lips, your fingernails turn blue, and you just can't stop coughing or wheezing. Those are situations where you would seek immediate medical help for your asthma. Long term, the one thing we want to look at is to see if you're overusing that quick reliever medicine. And I shouldn't have used the term overusing. I should have used the term you need quick reliever often. If you need quick reliever or rescue medicine often, it means that your maintenance therapy for asthma isn't working as well as it should be. And so even if you get good relief with your quick inhaler, but you're using it more than 2 times a week during the day or 2 times a month at night, then it means that your regular maintenance medicine for your asthma might not be enough to control it, and we need to look at other things with that. Even if that quick reliever is helping you, we want you to use it less than 2 times per week or 2 times per month at night. And then if you need oral steroids more than twice a year, then we're going to talk about trigger avoidance. We're going to talk about your maintenance medicine a little bit more. So even if those oral steroids help you a whole bunch, our goal is that you not need those. And so we really want to fine-tune your maintenance therapy with that. The other thing I recommend for everyone that has a diagnosis of asthma is that they have what's called an asthma action plan at home. And an asthma action plan helps you know what to do when your breathing gets worse. All right, so it's situated into these different zones that are meant to mimic a stoplight. So there's a green zone, a yellow zone, and a red zone. So green zone means go. You're doing great. Everything is good. You're not having any problems with your breathing whatsoever. You're taking your controller medicine, your preventative medicine as directed if you need those, but you're feeling great. You're not having any problems that day. Yellow means, wait a minute, I'm having some kind of asthma symptom. I either was exposed to a trigger that I know is going to cause asthma symptoms. I might have a little bit of cough. I might have a little bit of chest tightness, but asthma symptoms are starting. So I need to slow down and I need to do something to treat those. And then red means danger. So red means like a stoplight, stop. that you are having significant asthma symptoms. You are having trouble, again, like the trouble speaking, your lips and things are turning blue, you're breathing really, really fast, your medicine isn't working for you, you're having trouble, your ribs are showing while you're breathing, especially in children. That is stop. We need to seek medical attention, and we need to get this under control. And so the yellow zone so the green zone, you just continue with your usual medicine. The yellow zone, which means you're starting to have symptoms, we're going to give you a rescue medicine, and you need to start taking it. And if your symptoms get better, you can stay at home and everything is good. If your symptoms get worse, you need to go seek help. If your symptoms get a little bit better, but not totally better, then we may schedule some additional medicine for you for a few days with that. And then you come in and you see your doctor. But we're all just trying to see in that yellow zone if we can get your breathing better with that. So, and everyone's is going to look different. That's why these are blank, right? Not everyone is going to have the same rescue plan. So you work with your physician to develop what your rescue plan is and when to start these rescue medicines when you're at home. All right, and then I just want to wrap things up today. I wanted to leave lots of time for questions if anybody has any. There are some community support that you can get. The American Lung Association has a support network that is extensive, that you can get lots of information about asthma on that community support page. And then the Asthma and Allergy Foundation of America also has some good patient support associated with it. Lots of good information on both of these different websites for information regarding not just asthma, but other respiratory diseases as well. So with that, that kind of concludes the information that I wanted to present to you today. If anybody wants to come up and look at the inhalers or the spacers, I also have a demo here of the picture that I had on the screen that shows the difference in the lungs that are inflamed versus the lungs that aren't. If you want to come up and look at any of these today, please feel free to come up and do that. But if anybody has any questions, I'm happy to try to answer those today.
I had one, Dr. Hudson.
Okay.
I was curious about diagnosing asthma in infants.
Yes.
Like you said, your son was 1 year old
Yes.
when he was diagnosed, but my understanding from, I don't know much about it, but I thought it had to be like a very tactile, like encouragement, breathe, breathe, breathe. How do you do that with someone so young?
Yeah, so that's a great question. So the question was, in infants, how do they diagnose asthma? Because they can't really do those pulmonary function tests where you're instructing them when to breathe out, when to breathe in, and all of that kind of stuff. So with kids and those that are usually under the age of 5, it's totally based on symptoms and physical exam. You know, when did the symptoms start? What makes the symptoms better? What makes the symptoms worse? Are they wheezing on exam? All of those kind of things that kind of go into it. So they treat them as if they had asthma, and then when they get old enough, a lot of times then they'll send them for those pulmonary function tests that we had mentioned earlier. Yeah, but in babies, it's physician physical exam. Yes, sir.
I started out with a powder inhaler.
Uh-huh.
I don't have the name with me, I apologize. It wasn't the flat one, but it was the pop open.
Mm-hmm.
And I think you just suck it in, there's no trigger.
Right.
After doing that for a couple of days, my voice box was getting real hoarse.
Mm-hmm.
And I was a little, worried about that. The doctor told me, well, I haven't seen a lung specialist yet. I'll see it on the 5th next month.
Mm-hmm.
Okay, it'll be the first time. The ENT doctor told me I had asthma real bad, so
Yeah.
it's all about this at the moment.
Yeah.
So she changed me to a liquid inhaler, which you turn,
Yeah.
turn, and inhale it real
Yeah.
quick, okay, or slowly.
Mm-hmm.
After I do that, it seems like I have, I don't know how to describe it. It's like I'm trying to force a little bit of tone out of my throat. It's not that it swallows no difference, it's just a push. It's like right here, not here.
Uh-huh.
It seems to be. And I don't understand that. So it starts with S-T-A-R-I-V-I-C-A, something like that.
Okay.
Okay. And so 2.25 or 2.525 or whatever it is. And then according to my understanding, that's for COPD.
Yes. Okay.
I think I'm jumping into a lot of questions.
Yeah.
I'm sorry.
That's okay. Well, I'm just trying to remember them. I'll repeat them here so everyone can hear them. That's okay. We'll answer them one at a time. We've got it.
Slow down.
We got it.
First of all, when you inhale something, do you need to hold your breath for 10 seconds?
Great question. Okay, so the gentleman in the audience here was started on a dry powder inhaler, and when he first initiated it, a few days or a week or so after that, he noticed that he was getting hoarse associated with it. So we're going to talk about that one first. So inhalers can cause disruptions on your vocal cords, yes. So what they recommend, and they can also cause some thrush in your mouth. So I should have told you when we were using those inhalers that it's really important to rinse your mouth after you use them. And they may have told you that or may not have. You don't have to rinse and spit. You can rinse and swallow. But to rinse your palate and things like that, sometimes that helps with hoarseness as well. Sometimes it doesn't. We may just have to get a different inhaler for someone that is experiencing hoarseness with their inhaler. The other one you talked about was a different inhaler that you used and you feel like it got stuck, like the medicine kind of got stuck in your throat. Would you say it was stuck or?
It's like, so hard to describe.
It's hard for him to describe the feelings.
It's easy to turn your voice box on to go out.
Yeah.
But when it gets to where it's like, it's not as squeezy as it was, but it's a little flatter,
Okay.
but kind of hard. It's like closing up on me a little bit.
Yeah.
I think that I described it.
Yeah. So his best description of the symptoms he's having with the inhaler is that he feels like his voice box is not working right and that it's closing off a little bit. But your throat isn't closing. It's just the voice box portion of it, right? And so again, that can be a side effect of inhaled medication because they go right past, right, that voice box associated with that. I think you made a very good point a minute ago when you also asked if you need to hold that breath in, and the answer to that is yes. You hold it for as long as you can. 10 seconds is recommended. If you can't do 10 seconds, do as long as you can, but we would count on our fingers like this for 10 seconds. With that. And so to get that breath in and hold it for a good 10 seconds, yes, that is what we would recommend. And then washing and rinsing your mouth, especially if it's a steroid inhaler. You also mentioned that they changed you to another inhaler that you think is more COPD, which is another respiratory disease focused inhaler. And there are some inhalers that work for both conditions. There are some that work for both asthma and for COPD. Then there's some just for COPD as well. Yeah, it's okay.
The question was, it was a 2.25, which it described me.
Uh-huh.
And I did a research,
Uh-huh.
and it's for COPD. It's for once a day.
Okay.
Two draws within a minute apart.
Uh-huh.
I should be taking a 1.25.
For asthma.
For asthma.
Okay.
And I still have the 2.25.
Yeah.
I don't do it every day because I don't really have that much triggers.
Okay.
At least at the moment. So I'm kind of worried about even using it.
Okay. So to clarify the question, it was that he looked at the dose, and there's one dose that you use for asthma and one dose that you use for COPD. And there were some concerns that we were prescribed the dose for COPD versus the dose for asthma. And so I think you also mentioned to me that you go and see the lung specialist soon. And so hopefully there can be some clarification on whether or not what's happening in your lungs is asthma or whether or not it's COPD. Hopefully they'll be able to distinguish it. And I'll be honest with you, we have some people that have both asthma and COPD with that. And so I would still go ahead and use that medication because it's approved for use in asthma and it's approved for use in COPD. So I would just kind of keep on it. Sometimes medicines for breathing disorders don't make us feel better right away at all. But what they're doing is they're preventing damage down the road. So if we stop using them, then sometimes our lungs undergo damage that we can't correct, even if that medicine doesn't make us feel better right away with that. Yes. So a lot of times in asthma, some of the medicine that we use to control it doesn't necessarily make us feel better right away, but it is preventing damage down the road. And that's why we stay on it. And so until you see that specialist that you're going to go see, my advice to you would be to stay on that one to see if, in case it is one of those that's preventing that damage down the road, even if it doesn't make you feel better right away.
So the powder inhaler, it causes a problem in my voice. And it took me off of it, which is wide, is that right?
Yes,
Okay.
yes, the powder inhalers do cause voice box issues, more so than the other ones.
Is that a temporarily, or would that be a long-term more effect? Keep using it.
It could be both. He asked if it was a temporary effect or if it was a long-term effect.
Is it dangerous if you don't stop?
Is it dangerous to your voice box?
Yeah.
No, it's just hoarseness, and it will go away when you stop the inhaler. Yeah.
Okay. Well, I'm going to get to the question. Go ahead, I'm not thinking what I was going to ask.
That's okay.
I thought I turned you off. I'm sorry.
That's okay.
That's a good question about the COPD. I quit 25 years ago.
Mm-hmm.
I get on treadmill for 20 minutes on a fast walk, roughly 20 minutes more. I work every day, I'm very active, exercise. I don't see any complications on my breathing. I mean, going upstairs, it got a little hard, and I ain't used to that. But anyway, because I'm not in perfect shape, I mean, I need to jog some. But the question I want to ask is coughing.
Coughing, yes.
It comes and goes, but
Yep.
it does increase. And when I sleep at night, I wake up off and on. And I don't know if that's from the asthma or it's from my dog, so it's questionable.
Sure.
I'm gonna get a pillow cover, see
Yeah.
if that helps.
Yeah.
I do wash it, clean my bed pretty frequently. I do have a cloth recliner, and I got some carpet in my house, and I'm gonna eliminate that because it does my. But the coughing is the only issue I really have.
Yeah.
So is that a good sign? I mean, early age, or is it can get worse?
So the question is for our online audience. We're talking about different triggers and some things this gentleman is going to do in his home to help eliminate some of the triggers that he may or may not have until we find out if you have asthma or you have COPD. So COPD can show up even after you've stopped smoking for several years. So I applaud you for going to the pulmonary specialist to kind of figure out which avenue, because there are different treatments related to that. And so your main symptom is cough. So cough can either be asthma or it can be COPD. It could be either one associated with that. So I can't tell you if you cough, you're more likely to have one versus the other with that. So those lung studies that they likely will do will help answer those kind of questions.
So the 2.25 inhaler liquid one that you twist, do that.
On that inhaler that you use, that you twist at the bottom, does a vapor come out of it, or do you breathe it in? It's a vapor?
Vapor.
That's a vapor. Okay. Yeah.
I think, I'm trying to remember, I think they do that and then a minute apart.
Yes. Yeah.
Hold my breath.
Yeah. So he's talking about with that inhaler that it's there's some really fancy new inhalers that are out there that actually can make a vapor in the inhaler. So you twist the bottom of it and you push a button and it produces a vapor similar to a nebulizer that you then breathe it in and you hold it for as long as you can, preferably up to 10 seconds. And then for your second puff, you would wait. If you are prescribed a second puff, you would wait about a minute or so in between, and then do another one like that. Yeah.
And slowly, right?
Slowly, yeah.
Okay. Would it be good to gargle instead of also just rinsing your mouth to gargle as well?
I think either one would be fine. He asked if you should rinse your mouth or gargle, and I think either one would be fine. It just gets that residual medicine that's in your mouth that has stuck to your mucous membranes in your mouth. It just washes it off for you. The throat, you would have to swallow. Yeah, you'd have to drink something afterwards to wash it down.
Just water or
Yeah, just water.
alcohol?
Well, I'm not going to advocate alcohol, but I would advocate water. Yeah, he's just teasing me. He's laughing. Yeah.
So it'd be good to continue with the inhaler until I see the
Yep, that's what I would do. Yes.
Is there a pill that they give you? Or
Usually there's, he asked if there was a pill form you can take. Usually it doesn't get to where it needs to in the pill form because you have to swallow it. It goes to your stomach. It goes through your bloodstream. And so it doesn't really get to where you really need it. And so the inhaled medicines are a lot better for either asthma or COPD.
So it's the inhalers mainly, right?
Inhalers mainly, yes. Yes.
So they're playing the two-part, that's kind of interesting, whether I'll do that or not.
The tube like one of these?
Yeah.
Yes. So with the one, he asked a question about the spacer device. With the medicine that you have right now that makes the vapor, you don't need one of these with that one.
Powder, is that what you-
Yeah. The ones that we use this for are the ones for when you actuate the inhaler. If you look at this, you can see it squirts really far.
Seems like-
Yeah, it just squirts that medicine really far, and if you put that in your mouth, it hits the back of your throat and you swallow. So by putting it in here and just providing a little bit of space, it's not going to hit the back of your throat. Yeah.
Okay, I'm worried about lung doctors especially, because I don't know whether Yahoo or what.
Sure.
I don't mean to be judgmental, but I haven't seen this Dr. Mosley.
Uh-huh.
Have you seen it, Dr. Mosley? Okay. He's located in Springdale, I believe it is. But anyway, I have to find out. I hope he's a good doctor, 'cause I don't know whether he has second opinion or.
Yeah, so the question is whether or not after you see the first one, if you should get a second opinion. And I think it depends on the relationship that you have when you go in there. Like when you go in there and you see a provider, how do you like the way that the information is presented to you? Sometimes if you hear information you don't like, that's different than the way that it's presented. So I would just say about a second opinion, wait till the first visit and kind of see, you get good gut feelings about your healthcare providers, and it's important to have a good trusting relationship with them. Yeah.
I guess I got in my head that some of these doctors like throw medication on you,
Yeah.
whether you need it or not.
Yeah.
Kind of pushed it. Right?
Yeah.
I'm just curious to put you in that situation. That's the reason I asked. The information you got has been great. I appreciate it.
Thank you.
Really helpful.
Thank you.
So, I need to find out if I got COPD or asthma.
Yes, sir. That's what I would recommend.
I hope
Keep that pulmonary appointment. Yes.
Yeah. I guess what's better is asthma and not COPD.
I don't know. They're both. You can live with both of them. Yes.
Okay,
Yes. Yeah.
She had heartworm. She was young.
Yeah.
She had lung damage.
Yeah.
How do I know if a dog has asthma?
Oh, that's a great question. So we're curious as to whether or not our pets have asthma. And I honestly don't know the answer to that. So if there's a veterinarian that's around, that they may know. I do know something very interesting that I saw is that I think they can diagnose some breathing disorders in pets, because I did see someone who created it's a plastic box, like a tub that has a lid on it. And they had to put because it's hard to give an animal an inhaler, right? So they put their pet in the plastic box, they put the lid on it, and there was a little hole that was cut out that they then used one of these nebulizer medicines that made the vapor, and took the tube from the nebulizer, put it into the box and where their pet was, and just left their pet in there while the nebulizer ran, and they just breathed in that air in that box. So there are those kind of situations that people have thought of, which makes me think that there must be some animals out there that have some kind of respiratory issues. I just don't know what the signs of that would look like, but yeah. Now he's kind of a big one to put into a box with that, but I'm sure that with the help of your vet, we could figure out some way to get that medicine in there if they need it.
I live in a country and pollen was pretty bad.
Yeah.
And it didn't seem to bother me. I have to cough occasionally, but
Yeah.
rarely. I live on a dirt road, right at the end of the pavement, about 2 blocks away, and then it's a straight shot. And them yahoos gotta come through there fast.
Yeah.
Anyway,
Yeah.
it's dirt, dust.
Yeah.
So, it's dust.
Dust can be a trigger too. He's asking about the pollen and the dust that's in the air as triggers for asthma, and they are. If someone has pollen, that's a trigger for their asthma, and it's this time of year when our cars turn yellow and it's just so thick and it's so heavy. There's a couple things that we would recommend. One is that they shower at night before they go to bed, so that they don't bring into their bedding all of that pollen that may be on their body. So making sure that that is washed off before you actually lay down and you go to bed. Keeping your car windows up, keeping your home windows down is really helpful during these high allergy kind of seasons. Wearing a mask sometimes when you're outdoors might be helpful as well. The dirt that comes up from the dirt road, yes, that might be a trigger for you as well. So a mask being outside. When you see that yahoo coming down the street really fast, then head for the inside until the dust settles just a little bit. That can be a hard one to manage when you're not really in control of how fast they drive on that road, though.
You know the blue masks that you had over your mouth from the COVID you had? Are those okay to use
Yeah.
to mow a lawn and that?
Yes.
Work okay?
Yeah, so he asked about the masks that we used during COVID. There's some blue ones, there's some white ones. You can get them you can get the surgical masks at different pharmacies, but also at home supply stores. They'll sell those what we call N95 respirator masks that are a little bit tighter for people that need to prevent fumes from coming in, like painters and stuff like that. And those you can use as well to help when you mow your grass. Especially, if grass is a big trigger, we would recommend that someone else mow your grass for you. But just to protect yourself while you're waiting to kind of determine what your triggers are, yeah, you can wear a mask with that.
I don't want to take up more of your time. If it asthma, the pollen or dust or whatever gets in the eye, can it interrupt your trigger your lungs?
Yeah. So he's asking if the pollen and the dust, if it gets into your eyes, if it can trigger it. Yes, it can. So anything that is like people that have really bad allergies, if we think about our body, the tissue that is affecting our nasal passages, our sinuses, the backs of our throat, it goes all the way down into our lungs. So if you're having allergy symptoms in your nasal passages, in your sinuses, up here in your face area, that tissue can you're going to have swelling continuing on down into your lungs. So it's super important in those that have allergies that your allergies be controlled. If you don't control your allergies, it's very, very difficult to control your asthma with that.
If it gets in your eyes?
Yeah.
In your eyes,
Mm-hmm.
and your eyes itch, can that trigger your lungs?
If you have itchy eyes, yes, because if it's getting in your eyes, it's probably getting in your nose and in your mouth and everywhere else too. But you could just get some saline drops and rinse your eyes a couple times a day during allergy season to help with that.
I'm just saying, can it soak in and get into your lungs? Through your eyes?
Probably, yeah, that's a good question. He's asking if things can soak in through your eyes and get into your lungs, and that one I'm not as clear on. My advice would be that if you're getting it, since they're so close to each other in proximity, if you're getting stuff in your eyes, likely you're breathing it in through your nose as well. Yeah.
Very interesting, I appreciate it.
Oh, sure. It's my pleasure. Thank you for coming today. Thank you for everyone that joined us online today as well.
I feel bad with the only two.
It's good. It's good.
I'm thinking it ain't got nothing with you or anything. Probably just work hours.
Yes, yes. We have lots online, so I'm very happy to be here with all of that.
Those are great questions.
Yes,
Pardon?
Those are great questions.
yes.
Yes, I
Yes.
learned a lot.
Oh,
A lot
good.
of people
I appreciate it.
Good. You're welcome. All right, so I think with that, we'll go ahead and close it up. And thank everybody again. Our next series, like she said, I think is on PTSD, and it will be the second Friday
Yes.
of the month in
At that-
June.
Oh,
With
at
that.
What was it, COPD?
PTSD.
Oh,
Yes, there is going to be a COPD one.
COPD, got
Yeah,
it,
there's
yeah.
going to be a COPD one later in the year. Absolutely.